So, primary complaint is patient is complaining of right heel pain. Obviously, that just tells us the location. And then we get into the history. A 22-year-old female collegiate dancer, so obviously she's young, she's active, um, presented for evaluation of a chronic right medial heel pain. So again, just the location, and then that also tells us that it's a long-term injury that she's been having issues with. Later, we find out that it's 9 months, so that's why I just noted it up here for myself. Without prior injuries. So that kind of indicates to me that this is an overuse injury or a stress injury more so than like something from surgery that we've had before or an acute injury that we had before that now has become chronic. This is more overuse, stress. Started off small, probably got a little more annoying. That's why she's here now. Symptoms were first noted 9 months prior to presentation. Again, probably not as bad as they are now. Now she's back. And were described as a sharp pain, which tells me ligament or muscle, as you can see that I noted. Also, I thought about later, could indicate some sort of nerve. Nerves typically noted as like burning or tingling, but could in some cases be sharp pain. Um, at the medial aspect of the heel, so obviously tons of tendons running through there, there's some nerves that run kind of around, I mean, we all know this, I feel stupid saying this, but down this inside of the foot, medial aspect of the foot, and then under the heel. Same with the tendons, and then obviously there's a couple of ligaments that could be included in there. But medial aspect of the heel, personally, it could include the side of the heel, but in my brain at the moment, I'm thinking, without looking at the patient hands-on, I'm thinking bottom of the foot. So I'm on the more muscular nerve path than I am ligament at the moment. Just below the medial malleolus. So that part kind of brings ligament for me back into it. Again, I'm thinking muscular or nerve because there's so many tendons, so many nerves that run exactly like I said, the inside of the foot, down under the medial malleolus, and then under the foot, and just barely touch the heel, not right, obviously, on the hard part of the heel, but they kind of come down and edge around the heel and then hit the more distal portion of the bottom of the heel. I feel like I'm over explaining because y'all already know what it is. Like, y'all already know what this means, but I feel like I have to dumb it down as part of the assignment. So now I'm just babbling. The pain radiates to the mid-plantar region of the heel. So that's kind of pushing me towards the nerve because that's nerve, again, nerve or muscle, because that's where those nerves are coming in and crossing. The patient further described the pain as a burning sensation. There's the nerve that I was waiting on. Could also be muscular because occasionally I have had people tell me that their muscular pain feels like it's burning and it had nothing to do with the nerve. It was literally just like a strain. So I'm still between the two. Within the this distribution and was worsening with weight bearing. So again, that just leads me to the chronic muscular or nerve issue, just backing up everything that we've had so far through the history. Physical exam, right foot and ankle, obviously. No swelling, which tells me that there's zero chronic inflammatory process going on. And the injury, while obviously bothersome and long term, is not enough to create an inflammatory response that I can see. So yeah. Oy. Um, Palpation, tenderness to palpate noted 2 centimeters below the medial malleolus. So I don't know if you can read it from here or not, but I kind of just listed all the things that kind of run under there. Because you have the retinaculum, which kind of holds tendons, nerves, all that under the retinaculum in place, same as on the lateral side. Deltoid ligament is kind of in that area, or at least portions of it. So now I'm kind of back towards there's still a possibility of a ligament issue. And then you had the tibial nerve and the medial plantar nerve, which both run under there and then, or like behind the medial malleolus, then under the malleolus, then under the foot. Over soft tissue. So again, not thinking bone, not like a stress. I'm not under the impression that it's like a stress fracture or something. Maybe earlier on when it mentioned chronic without prior injury and the sharp pain. But then as we get further and further into it and we see the burning sensation, the radiating pain, that kind of stuff, then like I'm leaning away from bone. And then here we see soft tissue. So again, leaning away from bone. Mild tenderness to palpation over the medial origin of the plantar fascia. So now the little googly eyes are because it says plantar fascia. And obviously I'm kind of leaning there already. But then I'm back to the nerves because that's where a lot of them, if you look at like the anatomy of a foot, if this is like the medial portion of your medial origin of the plantar fascia, your nerves kind of run. This is the medial part of the foot, and they kind of run along the side of the foot and then under and kind of meet. They kind of cross over that same area. So I'm between kind of the fascia muscular thing or the nerve thing. No other bony or soft tissue tenderness appreciated, which just tells me it's not really going anywhere other than the heel. Um, so could be earlier version of a nerve issue because there's no radiating pain down the foot, or early muscle issue where again there's no issue down the foot. Um, Range of motion within normal limits in all planes. Ankle strength 5 out of 5. So that kind of takes muscular away on my end because there's no issues and no pain was noted with either one of these. Not saying that there isn't pain, but for the purpose of just looking at the case study as the case study, um, it doesn't mention any pain, so that tells me that there is no pain. So you can't really do the pain with active movement or passive stretch deal. So again, kind of just leaning away from muscle a little bit. And then special test, syndesmotic squeeze test tells me no bony issues for the shin bones, and then no syndesmotic injury like shin splints or something along those lines. Um, I don't know if I'm supposed to tell you what I'm thinking or not, but I guess you'll see it in a minute when you read it. So that's all I got.